Hi, I'm the nurse, Chu Fan. Today we are going to talk about peritoneal dialysis catheter care plan. Understanding your peritoneal dialysis catheter. In order to perform peritoneal dialysis, a PD catheter will need to be placed into your abdomen. Your surgeon will work with you to identify appropriate location. A PT catheter is a flexible plastic tube. It's about the length of the ruler and the width of the pencil that allow dialysis fluid, called dialysate, to enter the abdominal cavity. Potoxy through the small blood vessels that are in the lining of the abdomen and the organs, and then drain the used dialysate back out again. So a permanent, safe access to the peritoneal cavity is a key to success for PD. The Tankoff catheter, which is considered the gold standard for peritoneal access. It is the most common used PD catheter, followed by the swan neck catheter. The Tankoff and the swan neck catheter terminal segment is either straight or coil. Catheter with the coil intraperitoneal segment may minimize infusions and pressure pain. There is no available evidence to support that a particular catheter is better than the Tankoff to prevent peritonitis. The number of the cuffs, single or double, and the extra-abdominal configuration, swan neck or Tankoff, are not important determinant of the rate infection or PD catheter survival. In contrast, the intra-abdominal portion appeared to be more important, as straight catheters have a significantly higher survival rate at 2 years than coil ones. In particular, 22% catheter survival for 2 years with the choice of a straight. Pre-operation preparation. Catheter placement procedure need to discuss with surgeon or kidney doctor. Locate exercise to maximize self-care skill. Patients should be able to look down and easily see and hear the wind. Patients should be evaluated while dressed and in the sitting position to determine belt-in location. We need to avoid scar, belt line, fat, and skin folds, cause moist area due to perspiration, pressure point from the clothing or area that cannot to be seen during the care. Mark exercise location after discussing with surgeon. Fasting after midnight, no food, no drink, or at least 8 hours before catheter insert. Also, we need to empty bladder and the bowel. So bowel preparation in the case of the previous history of constipation, we can use mineral oil, enema, or a suppository on the evening before surgery to empty the lower colon. Avoid sodium phosphate bowel preparation, for example, free enemas. Shower or bath with disinfectant soap on the day of surgery. Post-operation care. Keep sterile dressing clean, dry, and securely. Tap for 1 week unless there is a drainage or bleeding. If the dressing is solid, please contact your PD nurse for a dressing change. Report any bleeding, pain, or tenderness, or severe abdominal pain, fever to your kidney doctor immediately. Avoid high intra-abdominal pressure until surgery is healed. It takes 2 to 6 weeks. For example, severe coughing, heavy lifting more than 20 pounds, straining, and constipation. Also avoid climbing stairs. No showers or bath until excess site wound is completely healed. It takes up to 2 weeks. Long-term care. PD nurse will teach you how to keep your exercise and the catheter clean. Keeping this area clean will lower the chance of skin infection, as well as infection inside the belly, we call peritonitis. If you get the peritonitis, it must be treated right away. If you get peritonitis many times, or if it lasts a long time, then you may need to stop PD and change to hemodialysis. Most centers will recommend that you keep catheter in the place with tap. If the catheter moves a lot, you may harm the exercise. So don't let the clothes tug on your catheter. The skin around the exercise should be washed every day or every other day with antibacterial soap or cleaner recommended by your center that doesn't irritate the skin. The soap should stay in the same bottle it came in, so do not pour into another bottle. Bar soap is not recommended because bacteria will grow on it. Other types of cleansers, such as hydroperoxide or alcohol, shouldn't use unless your healthcare team tells you to do so. So following is some general guideline. Your center may have some more specific or different instruction. Here is my reference.